Sorry for the delay. We're preparing to go live now. We are live.
Okay. Okay, good afternoon to everyone listening in. As the chairperson for the Jefferson County Health Department Board of Trustees, I want to call the February board meeting to order and just remind everyone this is a virtual meeting. So, having called the meeting to order, could we have a roll call, please?
Mr. Deal,
Here.
Dr. Henry,
Present.
Mr. Prater,
My name is Brianne. I'm the communications.
Mr. Prater,
Here, sorry, I was muted.
that's okay. Mr. Pig,
I am here.
Miss Davis.
I am here as well.
Okay, so 5-member board is present, so we have a quorum. And we usually start these meetings off by reading the health department mission and vision. And could I ask Dr. Henry to do that, please?
Sure. The mission is JCHD will champion positive health outcomes and behaviors through innovative programs and community engagement. The vision is advancing the health and safety of Jefferson County.
Okay, thank you. Next item is approval of today's agenda. Everyone should have gotten a copy of that. Is there
I
any
make a motion to approve the agenda as presented.
Second.
So we have a motion and a second on the floor. Any discussion? Okay, hearing none. All in favor of the agenda as written, please say aye.
Aye.
Anyone opposed? Okay, the agenda is approved. Okay, next item is approval of minutes and expenditures. We have 3 sets of meeting minutes to be approved. The first is from January 21st meeting minutes. That was a special meeting to extend the mask order.
Make a motion to approve.
Second.
Okay, so motion and second to approve those meeting minutes. Any discussion? Okay, all in favor of approving those minutes, please say aye.
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 Anyone opposed? Okay, thank you. Those are approved. The next set of meeting minutes is from January 26th, which again was a special meeting to approve a vaccine agreement. Can I have a motion to approve those, please?
I make a motion.
Second.
Okay, a motion second to approve those minutes. Any discussion? Okay, hearing none. All in favor of approving those minutes, please say aye.
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 Anyone opposed? Those minutes are approved. And the last set of minutes are from the January 28th regular board meeting. Can I have a motion to approve those minutes, please?
Motion.
I have a question.
Okay,
At the particular part of that meeting, towards the end, when we discussed and voted on the bylaws, I wanted to change my vote on all of it. I had said yes on several of them and then no on one. And I wanted to change my vote to no on all of them, please. I didn't have them in front of me to look at them, so.
Ms. Davis, that you can't do that after the fact, that if you amend the minutes, it's to reflect what is more accurately done in the meeting. You cannot change your vote past the date by changing the minutes. The minutes record.
Sure about that.
I'm positive about that.
Okay.
Okay,
I'll put it on public record then. Everybody that was listening, I do not approve of any of the amendment changes to the bylaws. Period. Even
okay.
though it
So
can't be
noted.
changed in the minutes. So it'll be in today's minutes.
Correct. So
Thank you.
did we have a motion on those?
Motion to approve.
Okay,
Second.
and a second. So any other discussion? Hearing none, all in favor of approving those minutes, please say aye.
Aye.
Aye. Anyone opposed? All right.
Myself.
Okay, so you oppose, I'm sorry.
I just opposed what I voted on last time, even though Christie said I can't change it. So that's why I opposed it.
Okay, so we have some approval of expenditures. The first one is approval of the January 2021 expenditures. The amount that I have, hopefully it's correct, is $1,093,389.83. Can I have a motion to approve those, please?
I make that motion.
I'll second.
Okay, so we have a motion and second. Any discussion on that?
Was the payment to the contact tracing company included in that amount? And that's why it was so high? It's usually it's around 400,000 or 500,000 a month, right?
Kelly, could you comment on that, please?
You're still muted.
I'm so sorry.
There was a payment to Maximus in that
Yes.
payment.
January 14th, check 62189, it says.
Thank you, James. Appreciate that.
Okay, so any other discussion? Hearing none, all in favor of approving those expenditures, please say aye.
Aye.
And opposed?
I'm in opposition of the payment to the contact tracing company, but just registering my vote on that. Otherwise, yes, we approve.
Okay. Next, we've got approval of the January 2021 electronic payments. And the amount on those is $455,193.25.
So moved.
Second.
Okay, motion second. Any discussion on those? Hearing none, all in favor of approving those electronic payments, please say aye.
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 Anyone opposed? Okay, those are approved. So the final approval is pre-approval for March 2021 electronic payments. And the estimate on those is $486,140.25. You have a motion to approve
Motion to
those?
approve.
Second.
Okay, a motion and second to approve those. Any discussion on those? Okay, hearing none, all in favor, please say aye.
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 Anyone opposed? Okay, those are approved. So the next item we have is the director's report. Director Volmar.
Okay. I sent just a brief outline of the discussion points for today, but just wanted to catch everybody up on where we stand as far as our COVID testing, our vaccine, our case counts, and looking at continued guidance due to the improvement of our numbers. So for our COVID testing, we have actually reduced to 2 days per week. We started this the first week of February because we've had a reduced demand for tests. January, we had 517 requests for tests, and of those 209 went through and actually had the test completed. A small number of our testing staff have been reassigned over to our vaccine clinics in order to meet the increased demand we're seeing there. With our COVID vaccine, vaccine has been a hot topic as far as Jefferson County. Up until this past week, we've been kind of a vaccine desert. And I think we had some great allies who've advocated for us, and we have been able to get a one-time allocation of 3,000 doses for a mass event to do next week. So I'll talk about that in just a minute. But because of that, the total vaccine received as of today is 7,300 doses. Of that, 5,570 are first doses, and then 1,550 of those are booster doses. So we have to keep them separate. As you guys may have heard, we'll get the first doses, and then whatever we get for first doses and give out, the manufacturers hold that and send us 4 weeks later, because we use Moderna, the second doses. So we'll start getting those in. And the reason we're starting to have booster doses in stock is this will be next week will be our first week starting our booster dose clinics. The clinics that are scheduled for, doses given so far have been 1,732, and that's how many doses we've been able to pull in. Our vaccines, up to this point in time, we have been making requests for, say, 1,000 doses. You may get 200, you may get 0, you may get 500. You just don't know. They're doing a much better job of putting together a regular cadence for that. So we're anticipating from here on out about 600 doses per week. With that in mind, though, we are excited to be able to do 2 mass events. One will be on March 1st and the other on March 2nd at the First Baptist Church of Arnold. It is by appointment only. So we have a lot of people on our registration list who put in their names, gone through the process, and those individuals will receive a personal invite to get their appointment scheduled. So the only way to get the appointment is actually to be on the registry, go through the process, and then we'll start opening those slots. To let you know, we did fix the situation that we had. I know that some of you asked about that last time, or I'm not sure if it happened about the time of our board meeting, but we had it was the first time opening tier 2 for our appointment slots, and that tier had about 21,000 people in it. And inadvertently, it wasn't a big deal on the phase 1A and phase 1B tier 1 because they weren't so large. Once we opened up to tier 2, it caused a major push on our system. So the way that we are doing things now is we look at the number of shots doses we have available, and we open it by the order of registration and by tier. So for our 700 person clinic, we just completed this past Saturday, we opened 200 in 1A, 200 in 1B tier 1, and 200 in 1B tier 2. We gave them time to get the registrations in, and then we've sent it to another 200 of each of those and work our way up the list. So that way there's time for people who are on the list and their orders to get their schedules meet, but it also gives the opportunity for others to get in line. Trying to look here. One thing I just wanted to show you real quick. I'm going to share my screen a couple times here. This is a allocation of our, can you see the chart? I'm just making sure I'm showing the right screen. Okay. Yeah. This is the percent of Region C population that's vaccinated as of today on the state website. So this is utilizing the state of Missouri vaccine website. Basically, as far as they're concerned, we're sitting somewhere around 7.6, 7.8%. We're right now the third lowest in terms of the percent of our population that is vaccinated compared to the other 11 counties, which are in our region. The renewed cadence that they're starting to put out, and as well as being eligible for some of these larger mass vaccination events, is going to make a significant improvement in our ability to increase those numbers relatively quickly. The other thing about this is that both Moderna and Pfizer have significantly picked up their vaccine production. And so more vaccine is steadily coming on the market, as well as we're anticipating Johnson & Johnson coming up relatively soon, but we don't have a date on that yet. So that is, sorry, I didn't realize it would go. Trying to figure out, this is not good. Get back to where I am not sharing my screen.
I'm not noticing us live, by the way, on YouTube. I don't know if anybody else can see it, but I'm not able to find it.
Top left corner of your screen should say live on YouTube.
Yes, there's a red box.
Yeah, it does say that, but I'm not able to get it on my phone. I don't know why.
I'm not sure, but yeah, we'll be able to keep going with that. So the next thing I wanted to talk to you about was our COVID case counts. We have seen a steady decrease in our cases over the past 6 weeks, which is fantastic. 2 indicators from both the White House color metrics and the state public health warning guidelines, which are our new cases per week. And I meant to, as I'm popping around, I apologize. I'm just trying to go through a couple of the different pieces so that you can see them as we walk through. The week 7 metrics for Jefferson County, the new cases per week per 100,000 residents, we are seeing a 38% drop. So this is definitely, again, we're showing a good steady trend in declining in our numbers, as well as our percent positive have gone down. We did see a small increase this week, but I am fairly certain in looking at our numbers, that's due to the fact that there weren't as many tests completed. So if you don't have as many tests, then the positives are going to bump that number up a little bit. So I'm not too worried about that tiny blip there. The trend of our numbers has steadily been coming down. These indicators also coincide with our Harvard Global Health indicators, which still have us in the orange. So both of them are putting us in the orange right now. But on both of these scales, we are right on the cusp of yellow. So we are really close to making our way back down into that next level. What we need to do is just keep pushing what we've been doing and continue that work. But so for the Harvard Global Health, this is 10 and below will be yellow.
Yeah.
You're going to be looking at for your new cases per week. Did you? So for your new cases per week, for your I apologize, the White House indicators, it's below 100, or sorry, below 50 for yellow. So we're getting there. I say that a lot, but we definitely are getting there.
According to them, we are there, right, Kelly? It's just the Harvard that's got us in the orange right now, right?
No. So these are actually the White House indicators. So new cases per 100,000 per week is orange, and the percent positive per week is orange. We have that as well. I noticed on the Missouri report, I found that kind of strange. For this week, they actually had us trying to pull this up in yellow as far as Jefferson County. We were just barely in there. So again, it depends on, everybody's kind of working from different number sets. So we're all really close, but it goes to show how close we are. But in the state dashboard, it's showing us in the orange and our percent positive at 8.8. So they're showing us a little higher than we're showing. So again, these numbers are always kind of it depends on the day. So like these show 2 additional days than what our numbers in our report show. So that's why you'll see some fluctuation. Same thing with the CDC. The encouraging piece really with that though, is the fact that we are seeing our numbers are coming down, and those trends are definitely looking good. The one thing I did want to address really quickly is the issue of probables. We did get a request about our probables and how we count those in. And I just wanted I'd asked our epidemiologist, Sarah, to kind of get me some information about our probable cases compared to our positive cases, which is what a lot of people have questions about. So just so that folks know, CDC, probable is a CDC term. It's not your PCR tests. Since we started getting about, what is it? I believe in June, we started receiving our probable our antigen test results in about mid-June. And what you'll see is there's a big spike right here with the antigen test. So the antigen tests are the dark brown. This lighter brown is the combined, and then our PCR tests follow that other line. So because right now there weren't any, the brown line and the purple line for PCR tests are one and the same. what you'll see is there weren't a lot of tests being done, and almost all of them were positive for the antigen tests. As more tests became available on the market, it started to pull back in line with trend. But what you'll see here is really our antigen tests are trending along the same lines as our PCR tests. The line that's just remotely in the middle is the combined test results that's showing that. What I wanted to bring to light, though, is that 77% of the numbers that we call probables on our reports are antigen positive tests. So they are actually positive tests. They are just antigen positive tests, and those are not included. They're separated. I believe the state itself has actually started to separate these in their numbers. So you may be able to see this here is that they have the actual PCR tests and then they have their antigen tests. So they're reporting their antigen probables as well.
So the antigen tests are when people are getting, blood drawn, and they're checking to see if they have T cells?
The antigen tests are the tests that they're doing. So in the nursing homes, where they have the individuals, or in schools where they've got the tests, you're starting to see those tests as well. So I would defer to my, I apologize, but I will defer to my test clinical manager, which is Melissa, to be able to answer that. And if you don't mind, if I come back to you, I will get the specifics of it.
It's the immunities in the person's system is very high, and that's why
their
they're
antibodies.
positive for antigens, rather than testing positive for COVID. They're testing high in immunities instead, right?
They're testing for COVID. So these are tests for COVID.
Right. But the antigen is saying there's T cells, like maybe someone's already had COVID, they've recovered, now they have T cells, and those are the antigens as compared to just a positive COVID test.
So what you're looking at between the two, and I will ask I would like my my clinical manager to back me up on this to make sure that I'm answering this correctly. But my understanding is it is the difference between an active case and what it could be detecting of a previous case. So there may be the instance of the individual may have have developed immunity to it over a period of time.
Right.
So I apologize. I do want to keep moving forward. So I'm happy to follow up with you with Melissa and we can answer those.
I think a lot of people are just wanting to see those two figures separated, that they're two separate things.
So they are.
Okay.
That's why they're separated on our reports.
Kelly,
So yes, sir.
is that probable number a total number or a current number?
Our probable is a total number. So I'll go back to that. So there were 2,460 total probables between March 22nd and yesterday.
So a lot of those have been resolved, right?
Correct.
Okay.
Those are not added into the positives.
No.
Okay.
That's why we separate them as probables for the CDC definition. So we do not count them. Our positives are PCR positives.
Okay.
So in other words, a lot of those were negative tests.
No, they were positive tests. So, okay, moving on to the next section. I think the nice thing that I get to do today is I get to give you, I think, some good news. It's nice to be able to do that.
Give us good news. That's great.
So what does that mean, basically? That on November 19th, the state of Missouri put out their public health warning from the governor's office and basically set out guidelines for each of the counties across the state. Basically, they set out a basic list of standards that each of the counties, if your county is within this particular category, then you need to be doing these things. Up until I just had it a minute ago. Up until February 2nd, we were in category 1, which is extreme risk. So that's all of your mitigation measures. It meant that we had a high positivity rate. Our 7-day case average was over 300. And so as we have brought our numbers down and have implemented our prevention measures, we've been able to bring that down. On our I promise I will make this a little bit shorter in just a second, but I just want to be able to show you what we're looking at here. With the, so when we start to take a look at our indicators, basically what you're looking at is kind of the same things, your positivity rate. So here we saw our positivity rate come down below 14% for 2 weeks. When you want to be between 10 and 14%, that'll get you in category 2 instead of category 3. So there's 3 categories, we'd be in the middle one. The 7-day case average was between 100 and 349. So as you see, our numbers are coming down, and because we've had those decreases for 2 consecutive weeks, that allows us to move to the next category. You have to have them sustained for 2 weeks in a row before you can move down. So what that basically means is this week we are now in our first week of criteria of meeting the criteria for category 1, which is the lowest level on the governor's category risk scale. Even though it's still called serious risk, it's the lowest of his 3 tiers. We would have to go through another week of this in order to be able to have been said, yes, we've gone through 2 complete weeks and have met the measures. Because of that, I think that we can start taking a look at some of our guidelines and some of our recommendations. The one thing that I want to make sure that we keep very much in mind is that we are paying close attention to our numbers over time. This is the last graph I'll show you before I finish up, but this is our daily case count and our 7-day rolling average from the start of the pandemic in Jefferson County until just a couple of days ago. What I wanted to point out to you is that the green is when we started orders. So the order of emergency and the stay-at-home order started right in about here. This was our first holiday with Memorial Day, and you see a small blip. Oh, sorry, here. I'm on the wrong screen. Sorry. About here's where we started. Your small blip with the holiday. Here's where we stopped the stay-at-home order. We were doing pretty good. We had a holiday. Things kind of picked up a little bit from there. There were no restrictions in place in between this time period. So no stay-at-home orders, no masking orders, anything along those lines. We had Halloween here, and after Halloween, we noticed a dramatic increase in our numbers. So that was about the time that we were trying to warn the schools were all going back into session. We had Halloween, we had our first major holiday, starting to look into Thanksgiving. We had another blip, and then we put our mask order into place. What you'll notice is after our mask order, and I'm not saying that's the only end all be all of it, but the mask order went into place along with several of the counties around us, which will make a difference. Our numbers started to come down till right around Christmas time and New Year's. You'll see a small blip come up after those, probably about a 2-week period of time after that. And then our numbers have been steadily decreasing over time. So the important thing is, one, this is fantastic. I think we need to celebrate this, and we need to be able to make some adjustments in our guidelines based upon that. But we also need to be very mindful of the fact that when you take pieces out, you will see some increases. So we want to ensure that we're not taking things out too fast. We want to ensure that we are getting enough of our population vaccinated. So we're creating that herd immunity around those who can't get it, and are able to maybe start moving forward into the summer months. And the one other thing we want to keep in mind is the presence of the variant. So we have had the variant positive in Missouri, but only in one county, thankfully so far. The variants are a little more transmissible, not more deadly, just more transmissible. So we want to keep that in mind, but you can't let that stop you from where you're moving. So we want to make sure that we keep some prevention pieces in place, but be able to step forward. So my purpose in showing this is just helping you to understand that significant events, when people get together, you see big blips in that, as well as when you implement prevention measures, you're going to see a difference in your numbers. So as far as 2 things moving on from that is, one, I think that because our community numbers are coming down, our community numbers play a pretty significant role in what our schools do, as well as our nursing homes. We do not have control over what our nursing homes opening or closing. But we can all as a community make a difference in bringing our numbers down, which will allow them to have more opportunities based upon the CMS guidelines, which govern their opening and closing. So this has been a great improvement because this is helping to get our seniors closer to being able to have some more freedoms that we all want to have, as well as with our schools. I would like to take the time over the next month to convene with our superintendents to discuss how the lower numbers, if we continue to see these trends, how we might be able to adjust our guidelines and work with them going into bringing some recommendations back in March. With that said, though, all of the pieces, CDC, the governor's public health warning guidance, and our local data are showing that having the masks in place as an additional layer of protection has proven to be a good tool and a good additional tool to the tool set that we have. Wash your hands, wear a mask, stay home if you're sick. Those guidelines, social distancing, have really helped us to get a handle on this. And if we just hold out a little longer, we are going to get our hands wrapped around this and be able to walk into a much more a much easier summertime, I think. But with that being said, I will pass that back to Dennis and go from there.
Thank you, Director Vollmer. There's no old business on the agenda. We have 3 new business items. The first is discontinuation of the contact tracing contract, sorry. So Kelly, do you want to discuss that?
So the Maximus contract, we had brought them in when we were significantly overloaded with cases. The cases were extremely high. We were not able to meet the demand with our current staff. I feel that the number of cases coming in at this point in time is manageable for our internal staff, and feel that the investment locally is enough to be able to cover our needs, as well as to be able to discontinue the contract with Maximus. They've done a fantastic job for us and have helped us to catch up and have really done a great service. But I think that we can definitely start moving forward as an agency again and kind of getting back to norm.
I'll make a motion that we discontinue the contract with Maximus Maximus Federal
I
Service.
second it.
Okay, discussion. So what would be the last active date, Kelly, as of the end of this month?
I believe it's the end of this month. Yes, Teddy. Yeah.
And so do we still have a payment due for February?
I believe that we have an invoice outstanding. If you'd like, that we can get a copy of that to you guys.
So we just have one more, correct? Okay. Any other discussion on that? Got a motion and a second to discontinue that contract. All in favor, say aye.
Aye.
Anyone opposed to that? Okay, so it's approved to discontinue the contact tracing contract. Next item is consideration of extending the expiration date of our joint health order regarding face coverings. So in order to have some discussion, can I have a motion and a second on that?
I'll make the motion.
I'll second the motion.
Okay, so we have a motion and a second to consider extending the order. Do we have any discussion on that?
Yes, sir. I did quite a bit of homework this morning on Jeffco, St. Louis County, Jeffco in comparison to St. Louis, the city of St. Louis, we have similar population. We have 225,000, they have 308,000. We had 21,000 cases, they had 21,000 cases. We had 210 deaths and they had 416 deaths. Our percentage deaths to population is 0.09, or 1 out of every 1,000 people have died from COVID since the beginning of the event here. Going through each and every county, starting with St. Louis, I just said St. Louis, but St. Charles, they have 70,000 population. Their cases were 35,000 positive and 426 COVID deaths. We only had 210 and we have 225,000. So our numbers, and I did this all the way through St. Charles, Franklin County, St. Louis County, St. Francis County. I did Sweden, I did Ohio, North Carolina, Michigan, and New Jersey. The last 5, which is Sweden all the way down to New Jersey, have similar populations at 10 million, 11 million, 9 million. And in comparison for Jefferson County to all of those places, including Sweden, who had very, very light measures, no masking, they left their elementary schools open. Their percentage deaths to population is 0.15. Ours is 0.09. So we don't even have a percent, not even 1% death. So for every 1,000 people population, we have had 1 death. In Sweden, with very light to no measures, they had 1 person death to 800 population. So, and of course, they have a 10 million population. And then I just did the same thing for Ohio, North Carolina, Michigan, and New Jersey. And for example, the closest one to Sweden would be North Carolina with 10,600,000 population. They had, Sweden had 647,000 cases positive. North Carolina had 854,000 cases positive. The deaths in Sweden was 12,793 with 10 million people. North Carolina was 11,000 deaths with almost the same amount of population. In comparison, deaths to population, 0.13 for Sweden and 0.10, which is just a little teeny tiny bit more than us, not much. And that's a percent of a percent.
Okay.
So not even a percent.
Ms. Davis, may I ask real quick? I'm impressed that you have all of those numbers and that you've done your research this morning. My only thing is in just looking at the general population of Jefferson County, for those people that you represent, I'd like you to take a look into the camera on your phone and explain to the 204 people who lost a family member, including myself, to COVID, how 204 people's lives don't matter because they're not enough.
Did you say that they don't matter? Because I did not say that.
Miss Davis, when you say it's only 0%.
Okay.
I think you're picking a fight that way. Let's,
Miss
what I
Davis,
think would
Miss
be most
Davis.
important would be
So
to understand that in spite of everything that we've been through since last March, we're at 0.09%, not even 1% death rate for COVID in our county. And we just started using masks, maybe, not very long ago.
can I ask?
Honestly, they
Ms.
don't make a difference. And
So
we've
is
had
that-
so many people. I'm
is that
sorry, I don't mean to interrupt you. Go ahead and then I'll come back.
I'm just so is that your point that
Yeah. So my point is, I know that a lot of people think that masking is doing a lot to help. They keep repeating that you should wash your hands and keep a distance of 6 feet. If you're inside and you should keep 6 feet away from somebody. And if you can't, put a mask on, like if you're on a bus or whatever. But as long as you can get away from somebody, you're at least 6 feet. that's the safest situation you can have. But anyway, the masks themselves are not making a difference, because if they were, Sweden, their number would be super sky high, and they're not, because Ohio, North Carolina, Michigan, and New Jersey has similar populations. And they had some measures in place. They had some masking, they had some lockdowns, they had some things going on throughout the year.
Okay.
And we did as
Request to have the
well
floor, please.
at the beginning.
Yeah,
So what I'm
Can-
saying,
please wrap it up,
Is-
please. Okay.
sure, what I'm saying is, I've gotten a lot of people, our constituents, and I know you have too. In fact, this guy, Matt LaPlante, sent a full page. And I don't know if you guys have had time to look over that, but it's really, really good. It got me going, and that's when I did my homework. And sure enough, he's right on every aspect of it. And I think we should give our people a break. I think our numbers are coming down. It's really great news. I think the businesses and the schools would appreciate that. And I believe that it would be a great olive branch, as Kelly puts it, to the community. To they're begging us, literally begging us, to
Can I
please
have the floor,
don't
please?
renew the order.
Okay.
And so, doing all the homework that we did, this Mr. LaPlante, and I verified what he says. In addition to that, I came up with even more, that we're doing great in Jefferson County. Really good.
Okay, thank you. Tim?
Thank
have
you
the
for the floor. Ms. Vollmer, do you have the chart of the flu season handy to put up for me?
Yes, give me just a moment.
Could I make one quick comment? And Ms. Davis, I'm
Yes, sir.
not questioning your numbers, but you can't just compare different areas based solely on the number of population. There's so many demographic variables, for example, between the city and Jefferson County, that you have to take those into account too. So
Right,
that,
but everybody has the same
If I-
situation. They move away from each other 6 feet as well as we can out in the country too.
okay.
All the
Tim-
same thing, works the
Tim-
same.
Please, thank you. Just to make my point, I think that I know that there are two different viruses. And, the COVID virus is actually a little nastier, a little more contagious, and actually a little smaller than the flu virus. But I do want to point out one thing that is very stark. If we look at the red line, that is the 2021 flu season. It's almost non-existent compared to the last 3 years that we've had it. There's only one thing that we can attribute to this to, and that's not just the mask, but that's to all the protocols that are in place. Washing your hands, wearing your mask, staying 6 foot apart. That's very evident right here. That is probably the most stark graph that I've seen. So I do know and can tell you right now that masks are working along with washing your hands and staying 6 foot apart. Do I think? No. And I will agree with you, Susie. I don't think we need to stay in this forever. I
Thank
would
you.
like for us to get out of this as soon as we can, but I also want to be cautious about getting out of the, going out and then the storm too quick, because I've been there literally.
Not a storm
And
anymore.
if it had, I still got the floor, please. And have had issues going out in the storm too quick with a tornado sneaking around the corner that you didn't know was coming. So I think we need to be diligent. And I would personally, my thing is, I'd like to give it at least one more month and make sure that we're driving us down, that it's going to continue in the direction that we think it's going to. And by then, I believe that the vaccinations will be hopefully a lot of them be in place. At least we may not have everybody vaccinated, but I think there's going to be enough vaccines to be out there that everybody who wants one should be able to get them within in a very short period of time after that. And that was my only statement. I appreciate everybody giving me the time. Thank you.
I can understand what Mr. Pig is saying, and I'd like to mention reason we're not seeing a whole lot of flu this year and last year is because COVID is that flu. It is that virus that is sweeping
No,
through
ma'am,
the
they're two different
country.
viruses.
Yeah.
They would not stop each other.
But
Okay.
it
Does anyone else?
is. I mean, when we're testing, we're picking up the SARS-CoV strain, which is our strain this year and last year for the flu. So again, going back to less than 1% infection rate.
Mr. Chair, may I
No,
have the
if
floor?
people want to go ahead and
Excuse me, I
still
move
use
to call
their
the
masks,
police, Mr.
Yeah,
Chair.
they will,
I
right?
want to call the question unless, does anyone else have any discussion they'd like to make?
What difference is
Mr.
it
Chair,
gonna
may I make one point, along with the school guidelines?
Yes.
Thank you. Just as a note to make, the governor's order that was put out as far as DESE and Department of Health and Senior Services, when they are looking at alternative quarantine guidelines for schools and for whether that is CDC in the community or with schools, they're looking at the fact that there has to be mandatory mask policies in place in order for a school to be eligible to even consider doing an alternative quarantine. So it is something that would be a disservice to be looking at.
That's
if
actually-
they're going to be trying to help the schools to move forward.
Not to disagree with Kelly, but because of the state of emergency that's in place, which is due to expire at the end of March, none of this is going to be going on anymore, other than the vaccinations will still be going forward. But once that state of emergency is over with, there aren't going to be guidelines like there are now. So, for the schools to have masks, no, they won't have to have masks. And as long as we're not saying,
That's a month away.
and we're not doing any penalties or fines. So I would say it'd be a great olive branch to the community to say, you know what, if you feel like you still need to wear a mask, you go right ahead. We're recommending them highly, but let this order expire. Why not now rather than 30 days from now? It's really, Tim, not going to make that much of a difference. And what a great olive branch. We've had so many people reach out to us. They would just be thrilled
Okay,
Well,
so.
to let go of this order. Just let it die. Let it die. Let
We'll
go.
call, so everyone's had their say, call the question. We've got a motion and second on the floor, and a vote of yes would extend the order through March 25th. All in favor of an extension, please say aye.
Aye.
Aye. Let me do a roll call since. Jettie, could you do a roll call, please?
Yes, Mr. Deal,
Yes.
Dr. Henry,
Yes.
Mr. Prater,
No.
Mr. Pig,
Yes.
Ms. Davis.
No.
Okay, so the extension until March 25th is approved by a 3-2 vote. Do we keep the same order number on there?
I can
Christie,
give you the new one.
okay,
It is 21-02-25-01.
okay, so that order number is approved. All right, next item is approval of a purchase agreement for real property. I'm not sure. Ms. Campbell, did you want to speak about that? Oh, I'm sorry, Christie.
I mean, sure.
Christie Coleman.
This is
Christie,
this is taking us a couple of months to get through the restrictions that were within the covenants that went along with the purchase agreement. And so I know this is something we've been working on for a long time. We've been going back and forth with the sellers council, and finally we're able to reach agreements on what we were willing to commit to. So this is something we've been working on. Johanna in my office has been working with Mr. Tufts and Mr. Sykes, and we're comfortable going and recommending the purchase agreement as it's been distributed for the board's approval, so we can go ahead and buy the property to eventually build a new center on.
So there were 3 separate documents that that were sent out to the board members. We had a purchase agreement, an addendum that included a waiver and permitted use, and then a warranty deed. So do we need one motion to approve those or separate motions?
You may have one motion because the agreement includes all three of those particular documents. The warranty is something that gets filed with the clerk once the property is closed on. The waiver and permitted use is that's the declaration that basically says to the extent that there's already covenants on that land, we've omitted those as pertains to our particular purpose of this land. And then you have the actual purchase agreement itself.
Okay.
Is it going to be public record now, how much we have paid for this, what our final price is?
Once the board has approved the agreement. So the motion would be the motion to approve the purchase agreement, the addendum to the declaration, and the warranty deed.
Someone submit that motion, please.
I move that we adopt all three of those and move forward into purchasing this piece of property that's very exciting for our county and for the health department.
I'll second that.
Okay, a motion and second, and just for everyone's information, as has been discussed, we've been working on this for a long time. The current health department building in Hillsborough is 70 years old. We've outgrown it. It needs, it's not in disrepair, but it needs a lot of upkeep. And so this is a step towards purchasing property and at some point a new building near the intersection of Highway 21 and Highway B. So that's what we're talking about.
Mr. Deal, I'd like to thank Mr. Tuss and Mr. Sykes for all their hard work, as well as Christy and her crew, and
Yes.
of course James and I kind of had to do some arm twisting amongst ourselves too. But I appreciate James. There's a lot of hard work put into this over this year with COVID and stuff. It kind of got crazy. So James, you have anything you want to add to that?
I'm just glad we're reaching the end of this part of it.
Yes.
It's a lovely piece of ground and it's well located.
I agree. And thanks to you too, Christy. We appreciate your work.
Absolutely, John. I've had a lot of good things to say about the team there on the board and at the health. You guys were just so easy to work with and very communicative. So thank you guys for your effort that you put in.
Okay, so there's a motion on the floor, and I'm sorry, did we give a second?
You did. I did.
I'm sorry. You're right, James. I'm sorry. Okay. So hearing no more discussion, all those in favor of approving the purchase agreement, please say aye.
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 Anyone opposed? Okay, so that passes.
Yay. When did they get started building?
Oh my God.
Are you two guys going to be on the same committee to come up with the building and building plans?
Yeah, it'll be quite a length of time, I'm sure. Probably 1 to 2 years, I would imagine.
Great.
Okay, can I have a motion to move into closed session, please?
I move that we go into closed session.
Second.
And the citation for that would be, let me see.
0.021, section 1, 2, and 14.
All right. Thanks, Tim.
Yes, sir.
Okay, so a motion and second to go into closed session. We need a roll call vote for that.
Deal,
Say again, please.
Mr. Deal,
Okay, yes.
Dr. Henry, Mr. Prater,
Yes.
Mr. Pegg,
Yes.
and Ms. Davis.
Yes.
Okay, we'll be going into closed session, so we'll stop the live YouTube feed for that, but we will come back when we go back into open session. So please keep that in mind.